Today, road rage and alcohol lead to clashes.
He's been spitting blood, flicking blood, and not letting the crew do any obs.
A man sustained severe injuries after collapsing in the street.
It's possible he'd broken his jaw.
And in Dudley, Steve hands out more than just medical help.
Is that okay?
Yes, thank you.
Is that okay?
That's beautiful. Thank you. When you put it on the tape.
Stabbings you can't predict, really. You can not go to one or hear of one for a long, long time, and then there'll be 4 in quick succession. And they can range from being minor to being life-threatening. I'm working with the lovely Dr. Dave tonight. I've known Dave for a long time. He was a doctor when I first started.
Started running on stabbing his brain to the abdomen, and it's not a million miles from the QE in Embark Green.
We've just had a call to us. Somebody's been stabbed in the abdomen. We don't know much else so far. The only person at the scene is an off-duty police officer. Obviously, the main things we're worried about is bleeding as the most life-threatening problem with the abdomen. And from a safety point of view, we will be concerned because we don't know who the alleged assailant is and whether they're still around.
No, you're obviously going to be driving past anyway, but the crew have stood you down. If you're happy to proceed with previous duties, then you can carry on in the direction you're going.
Take 3rd exit at roundabout.
As soon as we're here. Everything's all right.
Wait there.
Okay, you just need to wait, okay? You just hang on, just wait there a second.
So when we arrived, there was lots of traffic because it had been a road rage incident. So there was one car certainly that was stationary, not going anywhere. People weren't really understanding what was going on, so they were trying to move around that car, past the ambulance, put in police who were on scene in danger. There was blue lights going off everywhere. Do we know what he was stabbed with and stuff? Or?
It was just, we just went through that.
Or was it like a slash more than a...
Sorry.
Right, so it's a relative of somebody involved. There's a relative of somebody involved just turned up here. She's in quite a state. I've told her just to wait there. So if you can look after her while we have a quick look at the patient.
Yeah, right.
Cheers.
There was police trying to manage the scene and also questioning people who saw the incident because it was on a busy road.
This lady's a relative of somebody involved, yeah?
This is a doctor. This is Dave, okay?
Hi there. I'm David. I'm a doctor of the ambulance service. How are you getting on?
Paramedic crew. They'd done some observations and they'd covered the wound and they'd got some IV access into the vein in case they needed to give him any fluids or pain relief. How old are you, darling? We've got quite an extensive laceration. He thinks he's been slashed rather than... My first impression was that he was sitting up talking. He was fully conscious, fully aware of what was going on. That's always a good sign. Right, hospital knows you're going. So they'll be on standby when you get there to have a look at you. All right?
All the best.
Once the crew had handed over to us, we were quite happy that they could proceed with his care and move off quickly to hospital. Mick, I've told them 8 minutes from now.
Can I assist with something, maybe? The person that the offender has stabbed the guy's tyre before him.
Oh, OK.
The hole in the tyre is an inch wide, so the blade is an inch wide. Whether that has any gives you...
Well, it's quite a large wound, to be fair, isn't it?
It's probably a bit wide. It's probably about
2 inches wide, isn't it? So, OK, lovely. Sometimes you don't know what your patient's been with, and that makes it even more difficult to assess. But if you've got a blade in front of you, you can see potentially how far that knife's gone in.
About 4 minutes.
The patient had been in his vehicle, and the assailant had got out of the car, had slashed the patient's tyre, and then put the same weapon into the patient's abdomen. Can we move these cars here so the ambulance can get through?
You just reverse up a couple of feet. Don't bash our car. Just make it easier for the ambulance to get out, yeah? You can. So the situation is the patient's gone with the ambulance to hospital. It'll take them about 4 minutes to get there. There's nothing that we're going to do that will change anything. The best thing we can do is really not delay his onward journey. We can head back to base.
Yeah.
So we've just been sent to another station. We don't know any more details at the moment.
First exit at roundabout.
402, patient's currently being detained by police. Become very aggressive in back of ambulance. Is flicking blood around. Any crew attending probably want to be wearing an apron. The stab wound to the head is a male in his 40s to 50s, over.
02, that's you, thank you.
The patient flicking blood around, so it's not a very nice situation for anybody really.
Any ideas what happened? No. Presumably you've not been able to get a set of obs on him.
No, not at the moment. It's getting aggressive, so...
If we're responded to a stabbing incident or an assault, our control will always make sure police are in attendance before we get there. Police will make these incidents a priority.
I'm guessing BP over 90.
You didn't get anything.
That's reasonable.
Don't tell me, to hold me down, when I don't want to stay here. Listen, he won't look at my head.
Are they going to arrest him? That's probably the best bet. We've got to think about the safety of ourselves. So trying to treat him when he's in this state is just not an acceptable thing to do, really.
Listen, you're not going to hold me down, You're not going to hold me down.
All we know is, has he had a drink? We're suspecting alcohol. He's got a laceration on his head and maybe a hand injury, but he's not been cooperating at all. He's been spitting blood, flicking blood, and not letting the crew do any obs. So he's well, he's alert, he's orientated. We're not worried about him, but he does need to go to hospital just to have that stitched up. What's going to be the plan? Are you going to?
No, we're going to just go straight.
Just go. Do you want me to let Heartlands know?
Yeah,
I can let them know. What's your ETA going to be, and I'll let them know.
Say like
5-10 minutes. All right. I'll explain everything that's going on, just so they can expect to maybe get a room aside for you.
We'll just go on lights as well. Okay.
Yeah. All right. All right. I'll let everyone know then. All right. Okay. Let's shut this door. Yeah. Who's driving?
Me.
Are you staying in the back, or are you getting out? Okay. Good luck. Need to shut that door, I think. He saw a way out and tried to escape. Oh, actually, bear with. I've got to put the ramp up if you're going to drive away. You all right for me to do that? Do you want any other assistance or what? Yeah? You just jump on. Some gloves. I'm going to have to put this ramp up then, okay? It is frustrating because he's got several units of police here, and actually we don't know what's gone on, but he's actually the victim here at the minute.
Listen, I know you before,
If he was to sit in a chair, let us look at his injuries, bandage him up, do some obs and take him to hospital, then all these resources could go off and do what they need to do. There's no need really for this, and this is what's frustrating for us, I think, really. And he's been aggressive to the crews who are trying to help him, and that's also a big thing, and it's unnecessary. He's been restrained by the police. There is a lot of blood, but the wounds are, as stated, relatively minor. But obviously we just want him to know, because there's going to be lots of noise when they get there, Emma.
Yeah, I'll let them know, no worries.
Thank you. If you put them in the next 8 to 10 minutes, Emma.
Useful contribution to the evening so far. Some
Right then.
wipes.
Thank you.
Bye.
Always a pleasure.
Always a pleasure,
Cheers.
never a chore. See you later. If he'd have just let us help him, well, then none of that would have happened. But unfortunately, he's going under restraint now, under arrest for probably breaching the peace and being intoxicated, which is a shame, really. So yeah, we're not needed anyway, which is a good thing. So minor injuries. He'll live another day. Might have a headache tomorrow.
Basics is the British Association for Immediate Care Schemes, and its prime focus is to provide advanced care in the pre-hospital field.
Right, and we've got the major hemorrhage stuff, so we've got some swabs and some Celox gauze.
Basics doctors train medical students and assist paramedics out on the road.
Paramedics are trained to deliver excellent care, but there are limits to what they're allowed to do. Doctors can do procedures that their paramedics would otherwise be not able to do.
So we've just got a call. We're on our way to a male who's having a fit.
So this a chap who is apparently outside, and he's also got reports of a head injury, so he might have sustained a head injury and is now seizing, or he might be that he's still having a fit and has bumped his head on the way down. You on here? Hello there. Yeah. Oh yeah, that's all right. Can pop on. Come on, yeah. Thank you very much.
Just got here.
Hello, sir.
Hello, you're all right. I'm a medical student.
My name's Mike. I'm one of the doctors with the ambulance service. What's your name, sir?
Wayne.
What have you found out so far?
Diabetic.
Diabetic chap. Right. Do you know what happens, Wayne? Do you know what happened to you?
I was just starting to feel funny. I knew my blood sugar was low. I was just getting. I went into the right spine to get something cake or something.
Yeah.
Just getting dead confused, like, and I've come outside next minute and all that before. I'm type 1 diabetic. I've gone into town. My blood sugar has gone low. Started getting confused. Now I've ended up tripping over, knocking myself out.
Do you have this a lot where you, when you have a hypo, get a low blood sugar?
Not like that, no.
Not like that. It just suddenly collapsed and then banged your head on the way down. It's just a bit swollen.
Wayne's low blood sugar levels have caused him to have a hypoglycemic incident known as a hypo.
Mind if I just have a little look at you? Is that all right?
When we first met Wayne, he was awake and talking, but he was still finding difficulty in finding the right words. He was slurring his speech a little bit.
Can you still see all right, Wayne?
Yeah, it's just.
Yeah, it's just a bit swollen, isn't it?
And you could think that he was drunk. These are all possible consequences of having a low blood sugar.
Yeah. You managed to get up and walk into the ambulance, did you?
Yeah.
OK.
If the brain's not getting enough food, it's not working fast enough, and people can seem slow and slurred, and that's why they go off balance in the first place and fall over.
You hurt your wrist as well, have you? Here. This one's obviously sore here, isn't it?
It's possible he'd broken his jaw, but he certainly caused some wounds that were gaping open, and we're going to need some stitches.
It looks impressive. You taken a selfie yet?
No.
No. Fair enough.
The problem with having a low blood sugar or falling to the ground or having a seizure is you can easily sustain a head injury, and your brain can become injured just by impacting with the pavement.
The wound itself has got a small laceration just next to the eye. It's actually involving the eyelid. It's gone through the layers of the skin, so it probably needs a couple of little fine sutures just to stitch it up. Just something that you probably need to go to A&E for. We're going to just check your blood sugar, see what it's like now. What was it like before when you knew you had to get something?
I haven't tested it.
You're not tested, you just felt like you're having a hypo. Can you still see all right, Wayne?
1.1.
1.1? Wow. Okay, okay. There we are.
Yeah, that's a look at that twice.
That's pretty low. Right then, going to give this a little clean as well.
1.1 is really low. It should normally be over 4, so it's no surprise that he's felt unwell. In Wayne's case, we gave him some gel, but ideally you'd eat something.
Got some food in his bag, I'm just wondering. Might be a bit better.
Yeah. Well, should we do both? Because 1.1 is pretty low, isn't it? Yeah. Some hypo stop and some biscuits. Would be a good start.
Just chocolate bar and
a chocolate bar. That's a good start, isn't it? There you are. Yeah, good.
He'd just been to the shops and had got to carry a bag full of chocolate bars. He tried to eat it, but unfortunately the wound that he'd got made it difficult to eat. So we gave him another lot of the sugar gel, and then they could sort him out more at hospital with a bit more pain relief.
Right. Well, I think they're in capable hands here. Bless him. Right.
It's a day-to-day battle for people with diabetes, and they're always at a risk of having either a high or low blood sugar. and there are problems with both.
Okay. There you go, buddy. Do you want to crack on with your chocolate bar? Wayne?
Oh.
I know it's sore. You get some more chocolate into you. Get your sugars up. The stuff that you've had out of the tube only lasts a little while.
It was a shock. I was still up and walking about. So I can understand now why I was so confused and acting the way I was. Like.
Thanks, chaps.
Nice to meet you.
Yeah, nice to meet you as well.
Thank you very much.
Cheers.
Thanks, Wayne.
All right.
All right. Yeah, thanks very much. OK, cheers, Wayne.
I'd expect Wayne to make a full recovery, and he just needs to live with his diabetes and work with his GP to find the regime of medications that works for him.
I'm from South Wales. I currently live in a village, Pontypool, with wife and children and the dogs, and literally ended up coming up to here for work. I travel up there, it takes me just over an hour every shift. Well, the best thing about being a paramedic, I think, is the feeling that when you know you're making a difference, you are actually helping somebody. You know, that person is alive because of something you've done, or is getting better because of something you've done. We've just been assigned to attend a female who's had a 3-day history of back pains. It doesn't say whether she's injured herself or whether they've just come on, so we've got to make an assessment. For all we know, it could be a long, ongoing chronic condition, and the lady just can't get a doctor's appointment with her GP. We still respond on lights and sirens, obviously. Whether we need to or not will obviously determine once I arrive. Like I say, until we get there and assess her, we don't know.
Go on in.
Yeah, hello, my love.
Door's gonna slam.
Oh, door's just slammed. Right. What's your name then? It's what, sorry?
Susan.
Suzanne, oh, Suzanne. What's happened today?
My back, 3 days ago, I got up and I couldn't straighten up.
Right.
It eased off yesterday for a bit, and this morning I just can't straighten up at all. The pain's literally killing me.
OK. Have you taken any painkillers for it?
Not today, I haven't. The tramadol and that are not working anymore.
OK, so you're not getting any relief from taking tramadol or anything like that? It became quite apparent quite early on that lady was in quite severe pain. She was really upset. So if you had to score the pain, 0's nothing and 10's like the worst pain you've ever felt?
100.
It's that bad, isn't it? OK. And I think as well she was quite depressed by it. I think it had been something that had been getting her for quite a while, just getting gradually worse. And you haven't had any pain relief at all?
No, not today.
I just wanted to die. I just wanted the Lord to take me that morning because of the pain. I've never felt pain like it in my life. Never.
Pop this on your finger for me. Perfect. And have you had any problems, like, have you felt any problems with passing water or anything like that?
Yes, I have the last 3 days.
And you're having, like, numbness in that
Yes.
sort of feeling, yeah, OK. It's going to be a trip to hospital, then?
I'm not stopping in.
Well...
If you take me to know, I'll be booking myself out.
Right, well, initially it'll be a trip to Good Hope, all right? And then we'll have to go from there, like...
That morning, I refused because I've been that many times with it and got nowhere. Just to be told that it's sciatica, it's this, it's that, it's the other, and sent home. Normally, I refuse point blank to get in an ambulance. I will not get in it.
Right, let's have a look at your arm for me. See if we can't give you some pain relief. You've got quite little veins, haven't you? So we decided to give Susan some paracetamol in liquid form that we can administer directly into a vein.
It'll work a lot better than giving it to you any other way.
It's a lot faster acting than oral paracetamol. And if that hadn't worked, we could have escalated her pain relief to morphine.
And if you just pop that arm under there for me, just straighten it out for me as straight as you can.
Oh.
There's a problem. Let's have a look at the back of your hand.
When I first looked at Susan's arm, she had quite thin, thready veins. That's a problem because, obviously, as you're trying to advance the tube into the vein, it's quite easy for it to not tolerate the tube and pop, if you like, which causes the patient then, obviously, some discomfort.
Just relax your hand for me. Nice and soft, all right?
There's possible other risks associated with that. They get swelling, and it's not something that I'm proud when it happens.
There you go. Stay nice and still for me. There we go. So we're in. Pop that by there a second.
Oh.
Excellent. There we are. Not a moment of doubt, eh? Oh, a crew just arriving. Hello. Come on in. Come on in. This young lady, Susan, 3 days ago, she felt the back go. It eased, but today, same again. She now feels like she can't straighten at all. Only concern is she's got numbness going down her legs.
Do you want us to grab some Mentanox or anything as well?
Yeah, if we have some Mentanox, and if you can grab your paracetamol,
yeah,
that would be marvellous.
It's the first time this ever happened to you? You've never had a slip disc or anything before? A herniated disc or no surgeries on your back?
Those years ago with a crumbling, the bottom disc, your back crumbling.
Yeah.
But nothing like this.
27 years ago, they diagnosed me with a crumbled split disc at the bottom of my spine. Then I was diagnosed later on when the pain was getting worse. It was sciatica. Then later on, a couple of years ago, they diagnosed me with crumbling of the spine. The pain is getting worse, but I've got nowhere near why.
Are we still a 10 out of 10, Susan, or is it easing at all?
Let your hand relax, okay?
After 15 minutes, the pain relief begins to work, and Susan is finally able to move.
Now, we'll help you whatever way you want us to. All right, but we won't be lifting you, just in case it causes you any more pain. Do you understand that? Right. So, if you want to hold on to me to pull yourself up, that's fine. Just sit yourself down.
That's it.
Perfect. Right, is there any way that you can sit yourself back?
Are you able to lean back at all, sweetheart?
Oh, no.
No? Okay.
Mike, the paramedic, assured me that they are going to get to the bottom of it and get me the help.
God, if we come out.
And I think that's why I actually got in the ambulance in the end.
Right, a little bit of a push. Oh, sorry, is that your hand?
Shuffle yourself in the middle, love.
There we go. Now, we can bring your legs up a bit if you think that might help. So you're more of like a sat position in the middle of the bed. The lady was in a lot of pain. She's got an ongoing lower back problem anyway, where she suffers from a crumbling disc. So, you know, she does need to be transported off to hospital and get that surgical assessment as to whether she's going to need further treatment. Hopefully, you know, it's all early enough that she'll make a full recovery.
The doctors have said that there's nothing they can do for my spine. It's getting that bad that it will just get worse. When I heard that, I just wanted to give up now. But then I think back, my grandchildren, I can't give up. I've just got to carry on trying to manage it myself. So I am coping the best I can.
I don't think you could ever get bored doing this job. I always say it's like a tin of mucky soup. You never know what you're going to get till you get to the bottom of it. We've got an 81-year-old male that's on the floor, whether he's fallen or I don't really know, but he's on the floor for some reason and got a head injury, but we don't know anything else about it. But they want me just to go and assess and see what extra resources we need, if any. As a solo responder, I couldn't get him up off the floor, so I'm going to need somebody at some time. To avoid these little potholes. It's quite a big area that they're resurfacing. Let's just hope it doesn't take long to rectify it. Hello, my darling.
Hello, he only came out of Russell School yesterday.
Did he? Come on. Right. Hello, pussycat. Are we upstairs?
No.
Oh, he's here. Oh dear.
Halfway.
Right.
We're back there.
Your back's hurting. How many stairs have you fallen down?
Oh, we just...
Right, so we've just come down a couple of stairs. Can you remember about everything that's happened?
Oh, yeah.
Right, have you got any pain in your neck at all?
No.
Right, tell me whereabouts on your back that you're hurting. There?
Oh.
Just there, at the side. There's nothing down the middle at all? No?
There.
Bob had previously just come out of hospital, so was very weak. He'd fallen on the stairs and hit his head against a plant pot, and I believe had banged his ribs on the stairs. So he was in quite a bit of pain. Have we got a cushion or anything for his head? And maybe a towel, because we don't want to get spoiled. A towel to put over the cushion, because we don't want to get... 52, thank you. I'm going to ask for Red back up. He's in a precarious position on the stairs, over. For a solo responder, it's very difficult. You've got to try and balance your equipment on the stage and try to assess the patient at the same time. So it is important that I get back up as quick as I can. I just need to move all these things away so we don't hurt you even more than we need to. That's a nasty cut on your head. Okay. Pat, no worries. Thank you, my love. Okay. Let's try and rest your head on that. Is that any better? Slightly? When you went up the stairs, you were going up, not down. You've come backwards and fell on that side. You've fallen on that side, okay? But there's no pins and needles anywhere. Right, you move your feet a little bit. That's good, that's good. Let's just have a look at your finger. I just need to check your blood sugar. Okay. Sharp scratch. There you go.
Should be honest.
Does it normally run high? 10.2, how about that?
Okay.
Although Bob's blood sugar is normal, Kath notices something else that isn't as it should be.
Bob. Pat?
Yes.
At the moment, Bob's got a bit of a temperature.
Has he?
Yes, yeah. So when he came out of hospital, did they give him a discharge letter?
Yes.
Have you got that handy?
Yes.
Could I have a look at it, please? Thank you. Okay. It's not a high temperature, but it is a slight one. So, okay, my love. You want to come and sit down? Yeah, we don't want two patients, do we?
No.
Look up to silly. Right, kidney failure, been in hospital, and he came out yesterday. He is very weak, and he's... Was that today or yesterday? Yeah. And he's fell down a couple of stairs. Got quite a nasty head injury to the back of his head. There is... I can't see at the moment, but I can feel quite a deep cut. So we're just keeping him where he is until some help comes. Okay. Okay. Hi, mate. Right, this is Bob. Kidney failure. He's come down a couple of stairs. He's got no neck pain. He's got no back pain. However, he's got pain on inspiration, rib areas. We'd needed to move him to get him off the stairs, so we gave him pain relief initially before we moved him. We need to give him some morphine or some sort of pain relief, so we're going to give him some into a muscle in his arm. Once it's kicked in and he's got a little bit more pain relief, we should be able to sit him up. All right, my darling. Laura's going to come up to you now and we're just going to give you an injection.
Are you going to try and get some blood?
Well, no, we've had enough blood off you now. I think you've given enough looking at the carpet. Hey? Some jobs you have to rush. Some jobs you need to take your time over. Obviously, Pat's very upset and anxious. So because there's three of us, just to make sure that she's okay, one of our other colleagues is just going to give her a bit of a check over. It's a bit like a buy one, get one free. Laura's going to come back down and the two of us are going to sit you up gently and put a big bandage on your head.
Okay.
Okay?
I think my head's all right.
Yeah. Oh, come on, try.
Yeah, well, I'm going to zip.
You won't go anywhere. You're not going anywhere. Just try and sit up. Lovely? That's lovely. That's lovely. Oops. Just me. Damn. Typical.
Still no pain where I'm pressing down your neck?
Going again.
Okay. That's it, well done.
How about that?
Well done, Laura.
You're taller standing up.
Oh.
The bed is right behind you. You need to trust us, okay?
Lower down.
Down you go. Wow.
That's better.
Thank you.
You're welcome.
You made it. Well done.
He's okay, my love. He's got a bump on the back of his head, quite a nasty one, that he needs to go and get it looked at, okay? So he's on the stretcher now, he's sound, okay? Very often with an emergency, you don't always have one patient. You call to the one person that's ill, but they've got loving family around them and they can get very, very anxious and make themselves ill themselves. Can you actually take me off this job, please, and send another job with a different job number to the same address, as the patient's wife has been took poorly. So while the crew are going to deal with the gentleman, I'm going to stay behind and deal with the wife. It will probably be a VNR, but we just need to double check and make sure that she's all right. Received. On this occasion, Bob's lovely wife had got herself into such a state, hyperventilating and getting very, very anxious. So once the crew came to deal with Bob, I had to deal with his wife. OK, you take care. You're going to behave.
I'm strapped down.
You're strapped down. OK, that's good. I'm going to go back and make sure Pat's OK. All right. Thanks, Laura. All right, OK.
I'm feeling a bit better, thank you very much. I'm very grateful for all that they're doing for my husband and myself.
Any problems, if you feel you need us through the night, please call.
Thank you.
All right. All right.
Thank you very
Take
much.
care and carry on looking so young. Crikey.
You can deal with anxiety attacks in abundance sometimes. You can be called sort of any time of day to any location to somebody suffering an anxiety attack. I think in everyday life, in a modern day society, then stresses and strains of home life, work life, social life become sort of greater. So I'd say that anxiety is on the up, really. We're going to a 75-year-old lady who has breathing difficulties. We've not been given any further info, just control said it was an amber face-to-face job, so no other details whatsoever at the moment. When I'm in breathing difficulties, it's sort of like one of the most common calls we go out to all times of day, but yeah, particularly at night times. Patient symptoms seem to get worse at night. I met this lady before, and I don't remember her being a regular caller for breathing difficulties. There's a little note on the computer to say just to walk straight to the house. Knock, knock. Hello. Hello, sweet. What's your name?
Mrs. Doreen, Leah.
What's the trouble?
I woke up with my heart racing.
Okay.
I get a lot of panic and anxiety attacks, and I don't know when this one again.
Have you moved? Yeah, I thought I recognised your name when it came on the computer. How long have you been up here for?
4 years.
Oh, right, some time then. Doreen is a familiar face. I've not seen her for some years. So just to recap, you suffer with anxiety and you have palpitations.
Very bad.
Very bad. And you suffer with palpitations because of your anxiety?
Yes.
All right. As soon as I stepped foot in a house and I saw her face, I knew who she was. And she was quite happy to see me, I think. So just running past me, what's happened then? You've woken up with just describe the symptoms you've got.
My body's throbbing.
Your body's throbbing, right.
And I can't breathe.
Right.
I do suffer bad with panic and anxiety attacks.
Knowing how you feel, does it feel like panic and anxiety?
It could be, I don't.
It could be. Or can I have a listen to your chest? Is that okay?
Yeah.
Yeah? Okay. Take some deep, slow breaths for me. And out. All right, your chest's nice and clear. What I want to do now is do a heart tracing on you. Is that okay?
With pleasure.
And have your symptoms remained the same, or have they got worse or got better?
Now, seeing you, the symptoms.
Seem to have eased off a bit. Have I got that sort of face, have I? Oh, we try our best, don't we? Right.
You're a good team.
Thank you.
I've always been satisfactory with the hospital, thank you. I won't be here today.
That's lovely. Well, your ECG's, it's good, it's perfect. All right, it's not going fast, everything's where it should be, everything looks normal. So, do you think that the symptoms you have now are related to... Of course, all right. And when you suffer with your anxiety normally, what happens? Does it normally pass of its own accord?
Sometimes I've got breathing exercises to do.
And does that help? Yeah. You've tried those a little bit this morning?
Yes.
Yeah, has it eased it off a little bit?
Looks like it, yes.
Looks like it. All right. Would you say that you're feeling like you're starting to recover now?
Yes.
Yeah. Do you feel back to normal yet?
Yes.
I think sometimes when people call for help from the ambulance service, they don't need any particular clinical intervention. A couple of other little things I want to do, your temperature and your blood sugars. Is that all right?
With pleasure.
All right, thank you. They don't need needles, they don't need drugs, they don't even need assessment sometimes. Just give me a little scratch, OK? I think just a kind word and passing the time of day sometimes can reassure people enough to make them feel better. Right, everything I've checked, literally everything is normal, OK? Your pulse rate's normal, your ECG's normal, your blood pressure's normal, your oxygen saturation's normal.
Oh, thank you.
All right. I don't think there'll be any reason to go to the hospital. I don't suppose you want to go to the hospital, do you?
No, not really.
No, not really. I'm happy with everything I've checked, if you're happy.
God bless you.
Do you feel at ease now?
Yes, I do.
Do you want a cup of tea, Doreen?
I'd love one.
You'd love one.
Where the cups are, I'm sorry.
I'll sort it out. Do you take sugar?
No, thank you.
No, just milk, yeah?
Yeah, but not too strong.
Not too strong milk, no sugar. I'll sort that out. This is the first thing we got taught at training school, how to make a cup of tea. Check Doreen over. She's sort of calmed down somewhat. That quite happens with patients having anxiety, just to see the uniform sometimes, I think, even before we've done anything, calms them down. I've just told control that we're going to deal and that we don't need a big ambulance to take to hospital. This is proper ambulance tea. Middle of the night jobby. The tea boy's here, Doreen.
Thank you so much.
All right, I've not made it too strong for you, is that okay?
Yes, thank you.
Is that okay?
That's beautiful, thank you. Can you put it on the table, please?
Of course I can. Right, I'm going to go and get some paperwork from the car, and I'll come back and just jot a few bits and bobs down. Is that all right?
Yes.
All right, I won't be a moment, all right?
It means such a lot. Steve coming to visit me. Not only, you know, he's very pleasant, and he's got a nice personality, and he puts people's mind at ease.
Same day as my dad's. You're not twins, are you?
How old's Dad?
60.
Oh no, I'm older than he is.
Doreen, we can leave you in peace now, all right? It's lovely to see you again. It's been a while, hasn't it?
Yeah.
Yeah? I'm glad you're okay. You feel better?
Yes, thank you. Okay.
Okay. You take care, Doreen.
Tell him not to forgive his life.
All right. Okay, bye-bye.
Bye-bye, take care.
Bye-bye. We've assessed Doreen tonight, and it's not an acute problem. The important thing is she's made a full recovery. All her observations are fine. So we've made her a cup of tea, and she's happy to stay at home. So we're clear here, and we're going to move on to the next job.